Welcome back. Drug exam number 7. This is kind of a smaller exam. There are 4 medications on this exam, and they deal with patients having an allergic reaction. So, a couple of these medications are not medications that we carry on animals. A couple of them are medications that every animal carries. Okay, so we're going to talk about the ones that we see a lot more of, then we'll talk about the others. So the first medication we're going to talk about is diphenhydramine. Diphenhydramine is Benadryl. We've already talked about Benadryl before, so we're going to talk about Benadryl. Benadryl is a H1 blocker. It is an antihistamine. So it blocks that inflammatory response, the itching, stops that response that occurs when histamines are released. Okay, and it is given for allergic reactions. The nice thing about it is that it works really well with other medications. Now that can be a positive thing or that could be a negative because it works very well when given in conjunction with epinephrine. If you have a patient that's in anaphylactic shock or anaphylaxis, but if they're having an anaphylactic reaction, we of course would give epi first. We're going to talk about epi here in a minute, and then we would give the Benadryl. The dose is, again, 25 to 50 milligrams IV. Still, like I said previously, and I'm going to say it again, most protocols are towards that 25 number, not towards that 50. That 50 is going to snow a lot of people. And then the pediatric dose is 1 to 2 milligrams per kilogram. The onset's pretty quick. It only takes about 15 minutes or so for it to get going, and it does cause drowsiness. It does, remember I said earlier how it works well with other medications? It also potentiates alcohol and other central nervous system depressants, so that ability for it to make other medications work better is a detriment when it comes to alcohol or other central nervous system depressants. So just keep that in mind, knowing that that's why they say on the bottle, don't drink booze while you are on this medication, because it makes the effects of the alcohol better. It gives you more intoxicated. Don't try that. Don't try that. And the onset, like I said, is 10 to 15 minutes. The next medication that we're going to talk about is epinephrine. Epinephrine is also referred to as adrenaline. You know that you have adrenaline in your body. It's one of the catecholamines that is in the body. It is a sympathetic agonist. It's sympathetic. And how it works is it pokes that sympathetic nervous system and activates it. So when we talk about sympathetic nervous system versus parasympathetic nervous system, they are two parts of the autonomic nervous system, but they do the exact opposite. The sympathetic nervous system is your fight or flight. It's the thing that the body does to help you run from the dinosaur. It turns up the heart rate, a positive contractile effect. It turns up the contractility of the heart. That is a positive integral effect. It also widens the pupils so you can see better. It sends more blood to the muscles so you can run faster and longer. And we've all had a sympathetic reaction when you go to the haunted house and a monster jumps out and it startles you and your heart starts racing and you start breathing fast. That's because you are having a sympathetic reaction. You are scared. Your body doesn't know the difference between that person that's wearing a mask and the dinosaur that's going to try to eat you. So what it does is it kicks all these things into gear so you can fight or flight from whatever has scared you. Now, the dose for epinephrine in an allergic reaction and in anaphylaxis is 0.3 milligrams IM. I did not say IV. Okay, in this situation, we don't use the big abjects of epinephrine. We use small vials of epinephrine. That is a concentration of 1 milligram in 1 milliliter. So the big can boxes that have epi in it, they also have 1 milligram in them. And they are referred to as 1 to 10,000, the bigger ones are. And the smaller vials are 1 to 1,000. Now, we can give the 1 to 10,000 IV. We cannot give the 1 to 1,000 IV. We give that in an IM injection. The adult dose is 0.3 milligrams, and the pediatric dose is either, there's two ways of looking at it. You could say that the pediatric dose is 0.15 milligrams IM, or you can say it's 0.01 milligrams per kilogram. So once the patient gets up to 30 kilograms, that's the adult dose. One note, though, is that this cannot be given to women who are in active labor. Now, the onset is immediate. You're going to get that rush. If you give a patient an injection of epinephrine, they're going to feel jittery. They're going to feel like nervous a little bit because they've got a big hit of adrenaline going through their body, and it's going to make them feel a certain way. The next medication we're going to talk about is Tegamet. Tegamet is an anti-ulcer, and it is a blocker that helps with gastric problems associated with acid. So GERD, for example. GERD is gastric esophageal reflux disease. It's basically a chronic form of heartburn. You probably all had heartburn before, but if you have heartburn all the time, that's called GERD. And it can mimic the feeling of chest pain, because what happens is if you're producing too much stomach acid, that stomach acid can leave the stomach and go up into the esophagus. The esophagus is not made for to be in contact with stomach acid. So the stomach acid starts to burn the esophagus, and that's where you get that heartburn feeling. It's right there by the heart. So sometimes GERD can look like a heart attack, and we have to use our assessment tools to make sure that we can differentiate between those two things. So the dose is usually 400 milligrams given orally 4 times a day. So it's a pretty intensive medication to take. You got to take it 4 times a day. I only have to take my medicine once a day. I have trouble remembering to do that. So if I had to take it 4 times a day, I would pay a little bit back. The onset is 60 minutes, so it's a really long onset, longer than any of the other medications that we're going to talk about today. All right, the last medication we're going to talk about is Famotidine, or Pepcid. Pepcid is an anti-ulcer as well. It reduces the amount of stomach acid we what the stomach produces. So, if you're nervous and you're upset, your body creates more stomach acid. And that's how, like, having a lot of stress in your life can cause you ulcers because you're producing more acid, and therefore, eventually, the acid starts to eat at your stomach. It causes, that can even cause GI bleeding, and but that's all associated with the ulcers and too much stomach acid. So it can cause lots of problems with diarrhea, constipation, but those are pretty unusual. But it can cause prolonged QT syndrome, and we still haven't talked about that yet, but we'll get there. But it's prolonged QT syndrome. The adult dose is 20 milligrams given IV or 20 milligrams orally twice a day. And it usually takes up to 60 minutes for it to take effect. But it's less than the Tegamet. So Tegamet is the longest one of the four that we're going to talk about today. But then Pepcid's not far behind too. So that's all there was for today. There's only 4 medications that we were going to talk about. We are virtually 2 months into class, guys. Everything's going great. Keep up the good work.